Hello and welcome to the You've Got This Girl podcast, a space for celebrating all that we are as women, our struggles, our journeys, and our victories, sharing knowledge and inspiring stories of women accomplishing incredible things. I'm your host, Marilyn Brown, and my guest today is Dr. Leslie Swift. Dr. Swift has been a licensed physical therapist since 2008 with over 10 years' experience in pelvic floor physical therapy. Her areas of specialization include pelvic floor, pediatrics, and adolescent sports medicine. She is passionate about pelvic health related to pregnancy, postpartum, and pediatric patients. She currently teaches at Salisbury University's School of Health Sciences. Welcome, Dr. Swift.
Hi, thank you, Marilyn, for having me. I'm excited for this opportunity.
So, working with you on pelvic floor physical therapy was such an integral part of getting me back into my body after pregnancy. It feels like you come into your 6-week postpartum appointment, and often you're told to resume life as normal without really much guidance on assessing your pelvic floor health. Can you share a bit about the important work that you do with postpartum patients?
So when we think about like postpartum patients, it's, usually that's all the guidance they get is they have that 6-week follow-up. And even myself going to my first 6-week follow-up after our son, I was so excited. And then I left kind of going, well, it was great for the medical standpoint. But I left kind of going, oh, I didn't really get full approval of like the musculoskeletal standpoint. So, I mean, from my standpoint, I love pelvic floor PT, and I love it because working with pregnancy and postpartum women, they're kind of that postpartum woman is learning and connecting, but also reconnecting with her body. It's also a time where she's like kind of growing and learning her new roles and navigating that. And in addition, it's like I love just being able to encourage and empower them. And I think through that, like my friend, actually, Dr. Sarah Oleksak, she shared with me from a standpoint when I was talking to her about my son, she's like, you're the driver of the school bus. And I think I would share that with women and I used to share that with I share that with my patients and my clients. And I say, you're the driver of the bus of your healthcare. And the people in the passenger seats are all those medical providers, whether it's your primary care, your OBGYN, or your like massage therapist, whoever's there, your fitness coach, those individuals are kind of those passengers and you get to decide where to go. But oftentimes I feel like, and each of them have a role, they have that scope of practice that they emphasize on. So I think when you go to that 6-week visit and you hear, I'm all good, you're good to go, you can resume, you think, okay, that's all encompassing. I'm good. It's my doctor telling me that.
Mm-hmm.
But we want to think of what's the scope of practice for that physician.
Mm-hmm.
And they're checking, are the tissues healed? Are you good from their standpoint, from a tissue healing process that yes, you can return to activities?
Mm-hmm.
And now from the PT standpoint, people come and see me and we check the muscle standpoint. And we're not just for pelvic health, it's not just the pelvis, even though we love the pelvis.
Yeah.
It's looking at the whole individual
Mm-hmm.
to say orthopedically, there's a lot of changes that occur
Yeah.
over a 9-month period. And now we can look at that and be able to go, hey, from a musculoskeletal standpoint, your glutes aren't firing
Mm-hmm.
like maybe you intended. I don't know if you noticed, but I noticed after having Nolan, our little guy, like my butt was gone. I had no glutes. They weren't firing properly. And it was all the different postural changes, the physiological changes. And
Yeah.
I think that that's where we come in advocating because in some areas, women are well aware of pelvic floor PT. In other areas, I think in our area, not so much. It's kind of like, okay, you'll get back to it. It'll be fine. And we don't really realize there's any concerns until
Yeah.
after the fact.
Yeah, it's interesting when you talk about musculoskeletally because I didn't have so much with my son, but after I had my daughter, she hung out really low, like during a lot of the latter part of pregnancy. And I think just because of where she was and how my pelvis had to kind of relax and accommodate her for a longer period of time than with my son, for a while after I had issues with my, not my IT band, the one that goes in front, like right from your hip down.
That inguinal ligament.
Yes, yes. I had a lot of pain. Like I would walk a mile and all of a sudden I was in miserable pain and it just felt like things weren't quite back where they were supposed to be.
Yes. That's what, and even us as PTs, we start back thinking sure, we're good, but
Yeah.
we have to think through that process. Like it took 9 months. Your body just did 9 months, is 7 or 8 months to 9. I say 7 or 8 because we had ours delivered early. He came
Yeah.
2 months early, but like there were still lots of changes that
Yeah.
occurred over a month period, months of time.
Hmm.
And sometimes, oftentimes in 6 weeks, that's not even 2 months postpartum. It's
Yeah.
like, yeah, you're good. And especially if we're breastfeeding, like if we're breastfeeding, there's hormonal changes and laxity that's still occurring within our system that can result in injury if we're returning and we're not aware of,
Yeah.
fully aware of feeling that connection between our body and our muscles, aware of our body position.
Hmm.
There's a lot of that structural change when we have
Yeah.
postural changes. And I think that's where that PT comes in, of assessing and going, hey, let's work on this posture. Let's work
Yeah.
on the changes. And let's work on strengthening those areas, because one area is a little bit weaker. And that's why you're feeling this pain
Yeah.
here versus whereas before you didn't.
Yeah. Well, and it comes back to the idea of like, yes, your OB is going to make sure that you're intact and that you don't have an infection or something. But like, for me, even as a C-section mama, it was so interesting when you and I were working on my muscle activation because like I had a lot of numbness right down where my C-section scar was. It's something you have to relearn how to do, activating those muscles in that area of your body.
Yes, I've seen so many that it's just whether, I see it especially with C-section, but I've seen it also too with vaginal delivery, that there's just this disconnect. Like there's been a lot of stretching, and, in a C-section side, if we've had that incision, now we're like, wait, I can't feel something. You're asking me to feel it. And that PT standpoint allows you to get a little bit more in tuned with your body and reconnect to say, hey,
Yeah.
oh, there it is. It can also be challenging because I've
Yeah.
had women who have struggled to make that reconnection. And I tell them it's okay. It's going to
Yeah.
take time. This
Yeah.
isn't going to be a flip of the switch and we work on it 2 days and we're good.
Yeah.
It's going to take us time to repair and heal.
Yeah. Can you discuss a little bit of the nuance between C-sections versus vaginal delivery? Because I would imagine that there's like some additional guarding and things like that when you have the incision there that your body has to get past.
Yes. So, like, typically what I see when kind of one misconception I see across the board is a lot of times women think, like, oh, if I have, my pelvic floor isn't really impacted if I have a C section versus a vaginal delivery. But the pelvic floor is doing a lot of changes over those 9 months. It's carrying a lot more weight. So, we do see pelvic floor dysfunction even with the C
Mhm.
section, individuals who have a C section versus those who have a vaginal delivery. But with C-section, afterward, you're both are limited. They tell you encourage women, no matter the delivery, that, limit your lifting. And then, but C-section, you have a bit more because you're trying to heal as that mom. Posturally, you're trying to heal. You're trying to keep that wound clean and clear. And I think a lot of times what I see is a big disconnect that, years later, that nobody's told them about scar massage, and I see a lot of binding down. And I see women that come in to see me down the road that have pelvic pain. And it's because their scar tissue has bound from that
Mm.
C-section because they didn't touch it. They didn't want to. And for different reasons, and we all have those different reasons. And it's just educating women that, hey, once it's fully healed, let's make that connection with that, and highlighting it is a beautiful thing that you gave birth to this amazing baby, this amazing little one, and you're growing them, and this is part of that process and part of our new mindset of what it is, and it's still a part of your body. And I think sometimes we hide our scars, but I think it's important to
Mm.
understand that those scars, we want to work with them, and they need just as much care and love as we need and as that baby
Yeah.
needs.
Yeah, absolutely. I remember I had an experience with my scar tissue. It was like I think about 4 months after I had my son, and I tried to be pretty diligent with my scar massage, with seeing you. But there was one day where my husband and I were trying to do something. We had this silly contest where we were trying to jump and touch something that was on the ceiling because we're both volleyball players. So we are doing full approach jumps and jumping to touch something that was on the ceiling. and I hadn't extended like that yet. Like I felt fine, you know, I was lifting and doing other things at that point, but I had not gone and reached up and really extended like that. And man, when I tell you, I jumped and I reached and I thought I'd ripped in two. Like I came down and I was like, am I still together? Because it hurt so bad. Within a few minutes, it was gone. So I think it was like a piece of scar tissue or something that just kind of pulled loose.
Yes, yes. It can have, it's one of those, like, oftentimes there's different things and perspectives on scar tissue. People will go, there's no changing it, you know, the reality is scars are going to heal over about 18-month period.
Mm,
And in that 18 months, we really want to get as much mobility once it's fully healed. We don't do the scar before it's healed because
yeah.
it needs that time. But once it's healed, that's what we want to get on there and kind of just start gently working it and working the tissues around. And yes, sometimes after those movements, it's like, oh, but it can just be that you loosen things up.
Mm,
And now it's like, oh, I haven't moved like that in a while.
yeah.
So now you can increase those
Yeah.
ups and
Yeah.
and get more mobility.
Yes. And so talking about movement, you know, you and I discussed the importance of exercise even during pregnancy as a component of preparing for birth and, you know, also a lot of the misconceptions that are around it. Can you share your thoughts on that?
Yes. So there's a lot of different things. So I think about like some areas, if from a key component for preparing, oftentimes women will reach out and go, hey, when do I come see you for pelvic floor PT? I'm pregnant, but do I just wait till closer to delivery? Do I wait till after delivery? You can actually go see a pelvic floor PT anytime beforehand, because we're going to start prepping you and educating you on what those physiological changes are, what those postural changes are, assessing your muscular skeletal balances or imbalances at that time, and really help you prepare. We can give you too, there's different things of how your hips are moving. There's different positions you can be in to help, navigate and alleviate if you're having pains that start to creep up. We can start that early education and birth prep. Yes, PTs can do some
Mm,
of that birth prep of teaching you the musculoskeletal way of different positions you can be in. You can be in for labor. You can also different positions that can help alleviate some pain. Different birthing positions, like if people come in and they say, hey, I have a long-standing history of back pain. Okay, we can educate you through some birthing positions that are going to be better for you during that time to help where you have, avoid that back pain. Now, everybody's different. So at some point, you might be in one position during labor that feels great. And then 5 minutes later, it might not. And that's okay. It's just navigating, and we show you a lot of different positions that you
yeah.
can be.
Yeah.
You know, um, like the other part I think about it for exercise in general, for that pregnant woman, we have those groups that maybe they've never exercised before a
Mm,
day in their life. And now they're like, hey, I'm growing a little human inside and I really want to start, turning over a new leaf. Women can safely
mhm.
start. They talk to their medical provider and then talk with their physical therapist and say, hey, how do we start on that walking program?
Yeah.
They have seen health benefits to women and babies when they start on a progressive walking program.
Yeah.
Um, we also see it with that elite athlete or any of our athletes. The big thing is they used to emphasize for pregnancy low impact exercises.
Mm,
And I think about it, I actually just taught my class about this. We talk about it in our nutrition course. Um, there's low impact, but if I have an elite athlete and I'm now telling them they can't do anything that they did before, they now have to go to strictly walking or just swimming, and maybe those aren't their best, I have to also think as a practitioner, what is mentally that going to do
mm,
to that mama? Because there's a mental component to our physical fitness,
yeah.
and they're intertwined, and we want to keep them healthy,
Hmm.
all the way around. So it's talking with them and namely highlighting for pregnancy exercise, what are our red flags? We shouldn't have pain
Hmm.
when we're working out or doing any exercise. When we're pregnant, we should not be maxing to, like, maybe hot yoga is one that we kind of reduce down a little bit,
Hmm.
and we don't want to exercise to fatigue, because that can be detrimental to mom and baby. But the other part is we shouldn't have any bleeding or
Hmm.
concerns. But that's not to say we fully have to stop exercise. It means we need to take a step back. Our body's telling us, hey, my job right now is to grow this little amazing human. And I don't need to be setting personal records
Yeah.
for all my athletic endeavors. But and in reality, you're already setting a personal record because you've never experienced having a baby. If you haven't,
Yeah.
if this is your first, you know?
Yeah.
Um, but I think those are the things like we want to think about of what are the red flags? We shouldn't have pain. We shouldn't have bleeding. We want to make sure medically cleared.
Yeah.
So this is where kind of all those components of those different people on your bus are kind of
Yeah.
sitting to help you. You
Yeah.
go, let me get medical clearance from my OBGYN to say, am I cleared for these activities? Am I a high risk pregnancy or not? Because there may be times where you have more restriction, but it's for the safety of you and the baby.
Yeah.
Now, we also have those misconceptions where women are being educated like, okay, don't lift, you're pregnant, don't lift over 20 pounds. If I have a toddler at home,
Yep.
they're they're over 20
Or you're
pounds.
carrying groceries in,
E-
or yeah.
Exactly. So it's not to think that we are fragile because we are pregnant.
Hmm.
It's to realize that there's ways that we can protect ourselves. We
Hmm.
need to be aware of our risks. What do we have risk factor wise as individuals? And who are our resources that we can connect with to find out better ways to do things if
Yeah.
we do need to restrict or limit it?
Yeah, it's interesting because I lifted all the way through both of my pregnancies, all the way up to basically delivery, and I would get at the same time unsolicited comments that weren't scientifically backed, saying like, "Oh, you shouldn't be lifting that." I'm like, "Give me one shred of evidence that I shouldn't be. I'm not. I'm doing this for myself and for my baby. I'm not. There's not a shred of evidence that this is going to harm my baby in any way. And if anything." I've never understood the concept of like treat yourself like a delicate flower because you're about to go through one of the most transformative experiences in your life that requires the most fortitude of you physically and mentally. Why would you want to dull any of that part of you?
Yes, it is so challenging because I remember like for myself, we went in and I know there's different things out there that, there's evidence out there to show one way or another, but there's not anything that's saying why we can or can't. It just says the evidence is indicating, okay, there's red flags, there's things we need to be aware of.
Hmm.
That's what we need to highlight and give that woman kind of that choice too, and making her aware of that. These are when there's concerns. This is when we need to back off. Because I remember when we were expecting our little guy, I was running 3 days a week. And before we ever found out we were pregnant, running 3 days a week and then turning around and doing, I think it was T25 workouts 5 days a week. And then as we got further along, when I came to the level for me to bump up in the T25, I started to like realize I'm like, man, I had a little bit of spotting and I kind of went, okay, I need to back off. Like this is too high impact for me. So I transitioned. It didn't mean I stopped
Hmm.
everything. It meant my run went to walking, and then from there I said, okay, I'm still walking and getting out every day and walking. And then for workouts, I transitioned to my own weightlifting. And I was still able to continue that through the birth of our son.
Yeah.
And I think that's the thing of, there's this no evidence is out there, but we're hearing a lot of different variety and we're very quick to state based on what on the evidence we know.
Yeah.
Like, okay, this is the only thing that I've heard, so it's got to be true for everybody. And I think everybody's an individual, and
Yeah.
it's talking with their healthcare providers and also knowing their body. I love one book. It's Dr. Emily Oster. And actually, I have her book here, not like showcasing, but expecting better. So it's talking about like, you know, it's debunking things. It's research that looks at, hey, we say when pregnant women shouldn't eat this or shouldn't do that. Like, what are some things? And she collects the data on it to see what's
Hmm.
really out there.
Yeah.
There's also like the Thinking Woman's Guide to a Better Birth. Look, I'm like nerding it up with books here today. But and they're not great for everybody. I tell people like the Thinking Woman's Guide is evidence-based research on the interventions for pregnancy
Yeah.
and delivery. And for me, that's what I needed. I needed to read
Yeah.
some of those to go, okay, I feel equipped. But somebody who's not research driven, then you don't, but it's okay. Still know your
Yeah.
options,
I think it's
you
so
know?
hard too because I think for a lot of things with pregnancy, the default setting is don't do it because I feel like there's such little research. Like even a lot of the medications and other things, it's like, who's going to research a medication on a pregnant person? So a lot of things, there may be like almost no harm to it, but the default setting for a pregnant person is don't do it because of the fact that, that nobody wants to test on a pregnant person. And so I feel like it's always such a lagging indicator. Like when something becomes okay for pregnant people, it's like the science is so, I feel like, behind just because of nobody wants to run these studies on pregnant people.
It is challenging because I know like with research and those and the IRB, those institutional review boards that check it, they're excellent at keeping like low risk. So that's been the challenge because like I love research and I'm starting to dive into it a little bit more through my academic teaching career, which is awesome. But we do find it challenging when you're adding another person and now you have two. Essentially when that pregnant woman comes along, you have two subjects versus one. And how
Mhm.
are you maintaining that safety above? And which does limit us. And, but I think too, it's knowing that if we assess the risks and we go safely, I think that's the thing of being encouraged and encouraging each other through our experiences is what's going to help build that support
Yeah.
for, getting the right information out there and
Yeah.
not just being one-sided or the other.
Well, it's interesting too because I read something. I don't remember where exactly I read it, but it was something to the effect of women also are a lot of times like not even included in some of these studies because it's easier to control for a man because the man doesn't have the hormonal fluctuations throughout the month. So it's like women in general are not studied to the same with the same level of like rigor as or as frequently as men are.
Right. Yes, that's what it's actually funny. I share that with my class. We have our textbook has evidence-based practice in there, but it's interesting because you have limitations on it. And, we think about it right now. I told them, I was like, we have to celebrate when it has both
Mm,
men and women. I said, because before in a lot of others, it was solely just men.
mm.
I said, so now it's looking at expanding that research and kind of looking how can we assess and also account for these. We can't necessarily account for the cycle, but it can give us information and we can still collect data
Yeah.
on individuals to start getting more of that information
Yeah.
out there.
Which is so crazy to me that they would like that they would conduct these studies just I want to say purely out of convenience, but to a certain extent out of convenience, solely on men back in the day, and then just like extrapolate that like, oh yeah, like this will be fine for women too.
Women too. Yes, yes. Oh no. It's like we are different. There are different hormonal changes in there that occur. There are times when we are more at risk for laxity when our hormones are shifting and changing. And I think that's an important thing that I would love to see more research as we grow and kind of figuring out, hey, where do we really fall in
Yeah.
that sign?
And so something else that we've talked about that I think comes back to the importance of the pelvic floor physical therapy, particularly, is that many women experience issues like incontinence and things like that later in life that can be linked back potentially to unaddressed postpartum pelvic floor issues.
Mhm.
I would imagine that's something that really affects their self-image and mental health. Can you talk about what that's like working with that population, helping them finally get to the root of those symptoms?
Yes. So, and I know we talked before about this, like, so before I started to kind of specialize more in that pregnancy and postpartum, oftentimes I was sitting in the clinic and like seeing patient after patient in that older population that would sit there and their comment to me, the majority of the time I would constantly hear, I wish somebody had told me this after I had my kids. I
Mm-hmm.
wish somebody had told me this earlier. And, they did. They came in and some of them, and it's a variety. Some of them are like, hey, I don't think you can fix this. Do you know how old I am? Or, I don't know about this. I've been trying those Kegels and they're not helping. And, I think it's that this is a chance with that population. We can empower them because it does. It takes a mental toll. And actually, a colleague and I, Dr. Rettenauer and I have been talking about, we're looking at research into our future research is looking into athletes. And
Mm-hmm.
we've asked each other the question, how many female athletes do we think have stepped away from competition because of pelvic floor issues that they just haven't wanted to share.
Mm.
And that's something that's a concern for me as a pelvic floor PT. I'm going, wow, that's really concerning. And in addition to it, I've had moms that would come in and they would say, oh yeah, I'm the trampoline mom. I'm the only one that will get on the trampoline with the rest of the group. Nope, none of the other moms do, because they say, nope, I'm gonna leak. This is not. And we go over the black leggings or black pants. Most women will come in wearing black pants, and it's because you can't really see if we have a leak or concern.
Mhm.
So I think with those populations, we still make a change,
Yeah.
and I think it's changing the culture to know that the recommendation used to be, oh, just give them Kegels.
Mhm.
It's not. It's not
Yeah.
about Kegels. It's
Yeah.
about understanding why are they having, like, what's their underlying cause for this
Yeah.
pelvic floor dysfunction,
Yeah.
and then addressing, okay, let's restore the strength if that's the
Yeah.
problem. Let's restore the endurance, because all muscles have to have a quick fire,
Yeah.
and we need to have some endurance. We also talk about that coordination.
Yeah.
After delivery, we're taught, okay, our pelvic floor muscle works naturally in the sense that when pressure comes down from our
Mhm.
abdomen, we have increases in intra-abdominal, our pelvic floor fires to prevent leakage. Well, now think about, as we're delivering a baby, we're having to push a baby out
Yeah.
and try to relax. And the pelvic floor goes, wait a minute, when I get pressure, I usually contract.
Yeah.
So after that, sometimes that coordination is
Yeah.
altered, and getting that back can be very
Right.
challenging.
Well, also like, I mean, if there's another issue, I would imagine that's undiagnosed, like if they have like a prolapse and like you can do as many Kegels as you want. I mean, at that point, you need what I can't remember what it was called, a pessary or
Pessary,
yeah.
yes, yes. Kind of that, I love it. My doctor, Sarah, had went to a course and she shared with me, she's like, I love it because she goes, think of the pessary like a sports bra for
Mm.
your vagina. And I was like, it is. I'm going, that's incredible. Like their course, their instructor
Yeah.
shared that. And I was like, that's amazing.
Yeah.
Um, but that's the thing, like, sometimes there's a pessary is needed, and it's needed during those activities when women feel that pressure. So
Right.
pelvic organ prolapse, for those who may not know, it's just where you feel the common symptom we hear is that I feel like my bottom's it's falling out, like the bottom's falling out. I have this pressure down there. It may not be present all the time. It may be present only during like your activity or an aggravating activity, but it is a concern because we want to make sure if that prolapse has different levels and if it's coming out, down and out, then it can impact how we're providing support to ourselves, and it can cause pelvic floor dysfunction.
Yeah.
And it's interesting in like women who lifted, I took one of my first pelvic floor courses that I did. This was my second ever. We did our internal exams and we were working on this. And you had two groups. You had like half the group were athletes, prior athletes that had not had any kids. We had done Olympic lifts and everything. But then you had another half that they were PTs who, maybe lifted and things, but they were also moms. They had delivered. And it was interesting to see that the majority of the lifters actually had on our assessments pelvic organ prolapses, at
Mm.
least level 1. And we're like, that's interesting. So now it leads to those questions of what are we missing in our Olympic lifts, or what are we not talking about even pre
Mhm.
pregnancy that could predispose them
Yeah.
to problems after pregnancy? Because
Yeah.
especially following vaginal delivery, we have an opening that's now larger than it was before and can increase our risk of
Yeah.
prolapse.
Yeah, well, it's interesting too, I would think, because, I guess this is more of a question, but I would imagine that like this is something that can happen after your 6 week. Like it's not, it could be something that your doctor either it's not there when your doctor follows up at the 6 week or they miss it. And then it's like if you're not seeing a physical therapist or it's not recommended to you to follow up with a physical therapist who can explain to you what these symptoms are, then that can get missed. And then at that point you have that prolapse and nothing's being done to address it.
Yes, it can definitely be missed on there. It's not anything to the doctor missing
Hmm.
or anything. It's if you're not having those symptoms to start,
Yeah.
then you may not know. And plus, too, after thinking, for me, we had a vaginal delivery. That pressure is different, so it felt, there's like swelling and things that happen, and
Hmm.
you think, what is normal, what is
Yeah.
not, and then when you start your cycle back, you may continue to have some of that pressure during that cycle time. And so those are things that it's great to have a healthcare provider that you can kind of talk to about that
Mm-hmm.
and kind of go over it. But the other part is most of the time in our, when we go for our OBGYN checks, we are laying down, we're supine,
Mm-hmm.
and most of the time if prolapse, we're typically having those symptoms when we're doing an activity
Mm-hmm.
and we're standing, we're upright. So from a PT standpoint, like pelvic floor physical therapists can assess you laying down, but then we can also get you standing. We can
Mm-hmm.
also assess you while you're doing the activity that's
Yeah.
problematic and go, okay, hey, and work on strategies in that moment to say, hey, okay, in standing, when you're going into a squat, you have this pressure. Okay, we're checking and doing that exam and we're saying, okay, we feel that pressure of that prolapse
Mm-hmm.
and you feel that coming down and we can go, okay, now let's change your breathing pattern. And we can work right there in the clinic to
Yeah.
change your breathing pattern. And then you find strategies to go, oh, that did reduce.
Yeah.
Like, oh, that feels better.
Yeah. It was so funny, like even doing the exercises with you when I was, because a lot, especially with a lot of the endurance exercises where I would hold for like 5, 10 seconds, I'm like, man, pregnancy or not, I don't think I've ever had this endurance there. So like, even if you aren't having problems, I highly recommend, because like, pelvic floor health obviously extends past pregnancy and the postpartum period. And I'm like, I
Yes.
don't think I ever had this strength down there.
Yes, that endurance is the kicker. Most people are like, wait a minute. And I remember when we went my first course, they're sitting there and they're going, okay, now your endurance is only for the count that you're holding both the squeezers, those superficial and
Yeah.
those deep muscles. And I'm like, okay, wait a minute.
Yeah.
Those deep ones have it, but these little guys up
Yeah.
front, like,
Well, yeah, it was also interesting too, like as an athlete, having, because I still lift and everything. As an athlete, the all of those muscles being so close together, but then trying to isolate just one or the other, because you tighten all of them, and it's like all of them tighten at once, but like it's even a nuance of like tighten just this one or just that one to make sure it's not just one muscle that's like pulling the rest of them along, kind of thing.
yes, it's so funny because like even myself, like after having our little guy, I remember trying to reconnect with my pelvic floor and going, "Oh, wait a minute. Oh, I'm squeezing my thighs together. Oh,
Yeah,
those are my glutes acting up." Like I'm
yeah,
like, "Those big muscles." I'm going, "You guys can't be in this. I need my little muscles."
yeah,
And that's how I describe it to like patients and clients. I sit there and I go, "Think about having to walk to the bathroom and you're having to walk across the house. Your legs have got to get you there. So we can't have them substituting and doing the work because they're going to say, pelvic floor, see you later. I got to get us to the bathroom. You're on your own." And if your pelvic floor doesn't have that endurance,
yeah,
it's not a happy walk. Like,
yeah.
you know,
Yeah. But I think it's amazing work that you do, and it's just like any of these other things, like I talk about this with postpartum depression and stuff like that, because I had issues with postpartum depression, and dispelling a lot of the shame around these things, because they're issues
yes.
that, like, if you have the right team around you to help, they can be addressed. But I feel like there's so much shame around pelvic floor issues, or like leaking, incontinence, things like that, or postpartum depression. But it's like these are things that, like, your body just went through something so transformative. It's okay. But
Yes. Oh my gosh, that's one of my favorite parts about working with the postpartum population is because, and like being going through it myself too, helped to be aware because I went, oh wow, this is really a struggle. But it's giving yourself grace and helping to coach them through as we're working on the physical concerns. We're also improving mental, but
Mhm,
also, as the PT, I go, hey, here's some great counseling resources that maybe you want to talk to somebody about it.
mhm,
And that's okay because I think our approach to our pregnant and postpartum population should be multimodal. It should
mhm,
include, you've got your OBGYN, you've got your primary care physician that might tackle any other concerns, medical concerns, but you've got your pelvic floor PT, you've got your fitness and health and wellness coach, you've got your massage therapist. It's this combination, but you've also got your counselor that you're talking with because there's so many things that are. A woman is not just, like you say, it's transformative. You're not just stepping into, you
mhm.
know, oh, great, I'm relearning my body.
Yeah,
And I didn't used to wet myself and now I do.
yeah,
Or I didn't used to have that concern or feeling or pressure feeling and
yeah,
now I do. To now it's like, okay, I'm trying to navigate that while also accepting my role as mom
yeah,
and okay, am I breastfeeding? Am I not? And it's okay either way. At the end
Yeah.
of the day, as long as you're feeding your baby and you and the baby are alive and well, that's
Yeah.
what matters. And it's kind of
Yeah.
teaching us to give grace, which is
Yeah.
hard.
Well,
It's hard.
I think that I would hope that eventually it would be like a culture shift too, even within like, the OBGYN practices of like, because as a mom, I feel like in those first few months, gosh, there's such a blur. And so it's hard to even pull focus back to yourself and how you're feeling and how your body's feeling because you're so focused on baby, you're not getting any sleep. And so like I
Yes.
would hope eventually there would be a little bit more of a proactive approach from an OB perspective to be like, hey, I know you're feeling okay now, but like you should consider following up with a pelvic floor physical therapist, just have a couple sessions and make sure that everything's good. Because it wasn't something that was ever, at least for me, it wasn't something that was ever mentioned to me as like you should follow up. It was like, 6 weeks, you're good. And they talked about postpartum depression to a degree, and the pediatricians would screen me for it, but there was
Yes.
never any kind of like, hey, you should follow up just to see what your baseline is.
Yes, that's what I always remember going into the pediatrician office, and they do an excellent job of kind of asking those questions, screening you as the mom for postpartum depression.
Mhm.
And I love that. And I'm also like, okay, where we need to just be collaborative across the board.
Yeah.
And even, I mean, pelvic floor PT, like you can connect with them early on. You can
Mhm.
also connect with them postpartum, but being a part of it, that of, okay, there's going to be changes and I need
Mhm.
help navigating that. I think we do a disservice to our women when we're like, okay, you're good, just
Yeah.
get out there. And it's like, okay, I'm just trying to navigate this. Then the expectation kind of becomes, okay, I should be able to handle this. I
Mhm.
should be able to fix whatever is going on. And
Mhm.
it's not about fixing, it's about navigating and
Yeah.
reconnecting. There's been a lot of
Yeah.
changes and that's okay.
Yeah.
And that you do have that support.
Yeah.
And I would love to see where we start to advocate more and, really start to go, hey, let's connect with a pelvic floor PT. Let's just get your muscles checked out, see where there's any weakness, talk to them, because proactively, even if they're not ready in that moment, they can meet, they can have
Yeah.
that first appointment, maybe get a baseline and go, okay, when I'm ready, I
Yeah.
can go. And depends on the practice too. The cash-based practice that I used to be a part of and things and practiced a lot with before transitioning to academia. I mean, we love bring your kids. That's
Yeah.
what we want.
Yeah.
Like they're a part of that therapy. And we want to work with you to say, oh, hey, you're trying to get up and down off the floor. You're
Yeah.
trying to navigate holding the child. Let's do that together.
Yeah.
Let's work on that.
Yeah. Yeah, well, I mean,
And
I feel like that first step is having the tools to identify what is and isn't normal. I saw this post the other day, and it was just like it was like a meme, and it was like when you realize that your first matching outfit with your baby is a diaper,
oh yeah.
and I was like, very true, but like at some point it stops being normal, and at what point is that point where okay, now I'm having it's whatever it is, I'm 3 or 4 or 5 months postpartum, and I'm still having to wear some kind of protection. But at
Yes.
that point, you've already been cleared. So, at what point does that stop being normal?
Right, right. And I think that's the thing. Those are those conversations we need to have up front and like connecting with a pelvic floor PT. I tell you, that's one of the things I love about being a pelvic floor PT. We're all like all encompassing. We want to help each other.
Hmm.
There's different conferences we go to help. And that's what we navigate. We go, hey, look, if I can't, let me tell you, I've got this friend over here who does pelvic floor PT. Let's see if she has any openings. Like we're more than willing to help because we know how important it is.
Hmm.
Because it does impact mental health.
Yeah.
It does impact not just physical, it's physical, mental, emotional. And we want to remove that shame
Yeah.
aspect because you are good moms. You
Yeah.
and it's nothing's abnormal about the experience, but it is abnormal if this is continuing. Like if
Yeah.
that incontinence and that pressure is continuing, that's not normal.
Yeah.
And those are things where we want to really start educating people and making them
Mhm.
feel more comfortable about asking the question.
Yeah. Yeah. Well, I think it comes along with this whole concept of this innate change of, it's like you're a mom now, and like I think some of this can kind of slide into that where you
Mhm.
could kind of trick yourself into the concept of like, oh, I guess my body's just different now, and I guess I just have this incontinence issue, like I'm a mom now. And so like I feel like sometimes as a mom, like your own sense of self and your own sense of identity can sometimes like take a back burner, And like, if you're not filling your own cup and maybe issues that you should be like, that's a little weird. You're like, well, I guess I'm just a mom now.
Yep. Yeah. It's like it comes under that umbrella. Like,
Hmm.
okay, nobody talks about it, so I guess it should be okay.
Yeah.
But I think it's conversations like these. We open that conversation up
Yeah.
and we say, hey, it's okay to have that conversation. It's
Yeah.
okay to go in and say, look, I'm having a little leakage problem.
Hmm.
How long should this last?
Yeah.
And, what is normal?
Hmm.
And do you have a recommendation? Can I consult with a pelvic
Hmm.
floor PT? Do you have anybody
Yeah.
I can go to? And I think it's opening the door to those conversations
Hmm.
are how we really encourage women to
Yeah.
understand it's okay. Yep, I went through that too. And
Yeah.
oftentimes you don't know until
Yeah.
you're like face
There's
to face
community
with
in
another
that.
mom.
There's
Yes.
community, yeah. And that's why a lot of this project, I feel like I have enjoyed talking to a lot of women, because like it's these commonalities and those shared experiences, and sometimes it's things that don't get talked about. Like for me, it's been postpartum depression is one of my big ones, where like I will talk about that with anybody, because I don't want any woman to feel alone in that experience. Like having a baby is a transformative process, and there's joy, but there can also be a lot of complex emotions to it. And was talking a couple weeks ago with a postpartum doula. I was telling her about the fact that like I kind of attacked myself when I had those negative emotions, because I'm like, how dare you be upset? How dare you not feel amazing? You have a healthy baby. There's nothing wrong. Why are you upset? And it's like, you're allowed to have complex emotions around it, and it's not a shameful thing.
Right. Exactly. There's a quote out there and I don't even know who it's by, but we've seen it. It's kind of passed around in the pelvic health and midwife and everything, like the groups that I follow. And it's that like it's motherhood. It's okay to have moments where you're joyful and happy. I'm kind of
Hmm.
paraphrasing it, but it's also okay to not be okay with it.
Hmm.
To have moments where you're not okay. It's not happy.
Yeah.
That's okay too. Like it's us growing. And we think about, in anything in life when we're trying to grow and learn something new, it's kind of stretching us. We get
Hmm.
into that stretch zone. We want to avoid that panic zone that
Yeah.
we talk about, but we want to find, okay, this is going to stretch and grow me. It's going to be a little uncomfortable.
Hmm.
And what resources do I have that can help me in
Yeah.
this time? That's
Amazing.
that's where we need to kind of focus for our women. And I love that you're doing this podcast to like connect and show those resources to people
Hmm.
that they can say, hey, there's things out there that you can do that can help you,
Hmm.
and there's support. Like you say,
Yeah.
it's community. It's us standing up and saying, hey, this does happen and
Hmm.
you're not alone.
Yeah.
And we don't have to love every minute of it. And there's going to be struggles, but we share that struggle
Yes.
together and
Amazing.
we're
This
here.
is like exactly what I wanted out of this
Yeah.
conversation. And I thought of you and I was like, man, this is just, I love these topics that just don't get talked about. And I wanted to thank you so much for joining me for an episode today.
Yes. Oh my gosh. Thank you so much for having me. It was great to like reconnect and for us
Yeah.
to share and just be excited to hopefully reach and share and, kind of advocate for others out there.
Amazing. Awesome. Well, that'll do it for us today. And thank you so much, everybody, for tuning in. And we'll see you next week.